Today, the role of the anesthesiologist is not only limited to the operating room, but also extends to the critical care areas of ICU, also for pain services. The emergency room is also a battleground now. So I feel that in today's world, the anesthesiologist is a part and parcel of the entire treatment and someone who decides the real clinical outcomes of our patients. Back in 1846, W.T.G. Morton, a dentist, demonstrated the use of ether for a dental extraction. And the world changed after that. Gradual but steady improvements kept happening in this specialty. And today, we are in an era where the anesthesia we give is so precise that the patient is up after the surgery in a couple of minutes after the surgeon is done with the job that he entailed to do. Also, with the help and the advent of the ultrasound, which has aided us in being very precisely able to block the nerves supplying that area of the body where the surgeon is entailing the surgery, we have made sure that we can titrate and make the patient experience of surgery very painless. There have been multiple advancements that have come in the field of anesthesiology. The earliest and the most important ones is to develop a good anesthesia delivery machine, which is electronic, safe, and it helps us in titrating the amount of drug to be administered to the patient. But the real advent in anesthesia that has changed the game is patient safety devices, monitoring which has become way more invasive. Now we can also measure how deeply is your brain anesthetized while you're asleep. So all this has helped us in a better and safer control of your body while you lie asleep during surgery. But the evolution of anesthesia continues, and we anesthesiologists are very excited about it. Artificial intelligence, just as it is impacting all other spheres of life, is also set to change the paradigm in anesthesia, majorly in monitoring as well as safety devices. So now we are looking at target-controlled infusion devices wherein the machines themselves could help us in deciding how much dosage of a particular drug would help us put you to sleep and get you up on your toes earlier than normal. So a new era of safe anesthesia awaits us. This is at least the hope I am keeping in my heart. There are multiple challenges that an anesthesiologist faces on a daily basis. One of the most prominent ones that I'd like to talk about is the lack of awareness about the specialty. The problem that this raises is that most patients are unaware of the role that the anesthesiologist will play in their recovery. Hence, it becomes difficult for an anesthesiologist to discuss the options which could make surgery safer and more pain-free for these patients. Also, this lack of awareness is not just limited in the patient population, but also amongst many healthcare organizations as well. And the latest and the safest equipment and infrastructure needed for the development of this specialty may not be readily available at all healthcare organizations. This puts the anesthesiologist at a very uncomfortable spot. Also, as I have already mentioned, that many new drugs are readily being introduced into the anesthesia scenario. Certain drugs are yet not available in India, but many of the safer and shorter acting drugs are. Not many organizations have full access to these safer and shorter acting medicines. So out and out, I think if the awareness goes up, maybe the safety of anesthesia also will go up. For decades, anesthesia has been considered as a behind-the-curtain job. But if you truly ask me, it makes a lot of difference to the patient experience. Imagine you get your finger cut in the kitchen. How painful is that experience? And now imagine getting the most surgery done to your body under anesthesia while you are listening to some music as the surgeon operates upon you. That, I think, is sheer magic. So anesthesia keeps you pain-free, helps you forget what happened in a term called amnesia, and also supports healing. When your body is pain-free, they say You release stress hormones way lesser. All this contributes to tissue healing, faster recovery, and good outcomes. So anesthesia may be a thing that you do not directly see, but it impacts at every step of your recovery. Most healthcare organizations that I've heard of talk about great surgeons, talk about great equipment and technology. But we at Aakash Healthcare have another strength that we boast of, which is teamwork. It is a dynamic play between various specialties which come together to give patients our best. It is almost developing integrated care pathways for particular diseases so that the patient does not have to move door to door to get the best advice for their disease. Herein, the anesthesiologist works in close conjunction with the surgeon to devise programs which are enhanced recovery programs. What do I really mean by enhanced recovery? Enhanced recovery means everything that helps you get up from the bed earlier after you are operated, helps you get to your job faster after you are operated. And all that is possible because the surgeon alone does not take the responsibility of your recovery. The anesthesiologist, who I think is also a lifesaver, who I also think is a patient safety crusader, joins hands with the surgeon to give you the safest and the best surgical experience possible. We are aided in this thing by the latest technology, both in surgery as well as in anesthesia. We give you ultrasound guided blocks, which give you a very good painless experience. We also have the best-in-class monitoring devices to keep a look at you while you're operated, and you are safe under the observation of a very skilled and specialized anesthesia team.